because what happens is that if you really just pay for something based on what it costs to do, the cost is very small. What makes it cost so much at the hospital is that they're covering all those people you talked about who don't have anything. And so that's part of the cost shift too. So the hospital has to charge more because they're trying to keep themselves open and sustained, which is why I said part of what this collaborative would need to do is say, how many hospitals do we need and where, and how can we keep them open so that we don't have them incentivized to, test out the wazoo to keep them, to justify their existence. Yes, sir.
Yeah, I was going to ask whether it's possible when you talk about making doctors salary, that at the same time you also educate them to become business people.
Mm-hmm.
There is this really amazing interview on BBC, and I forgot the doctor's name, but it's a heart surgeon in India. And so his goal is to make heart surgery available to the 95% of the world population who can't even dream of thinking of doing that. And so he has started already off, I think, as like 1,000 hospital beds. And so when you listen to the interview, one thing he says, they're also business people. And so when they sew the heart together with these ultra-fine threads, they know that every inch costs, I don't know what it is, $100. So they become better at it to use less.
Right.
And the second one is, of course, that they have big places, so they can go to the pharmacy and get a much better price.
Right.
And then in India, what works really well too, he says, we have a responsibility to employ women. So 95% of the workers there are women, because he says, when they take their $100 a month home, they feed their family with that. The guy takes $50 and spends that somewhere else. So if you Google this, it's just an amazing talk, and you would think, well, heart surgery, let's not go there. Let's go colds and abdominal pain and heart, toothache, whatever. But I think it can be done.
Yeah.
We just can't give up. And just because they have dumb speeches on TV doesn't mean they're true.
Right. Well, you're actually making me think a little bit of, I've not actually seen them, but I know they exist. Those clinics that are happening now, like in Walmart and Walgreens and stuff. Part of why they're so inexpensive is because they're using the business model. And so when I said you were talking the Republican argument, that's what we want people to do, is utilize that business model. And so what you need to figure out is what's a fair price to pay for that population, and then have, data tracking satisfaction and all that stuff, and saying to them, you do it cheaper, it's yours. The incentive is there for you to keep it. So, but it has to be both. You have good outcomes, high patient satisfaction, and then you can keep access, and if you don't, then it comes back to the system. So you do want that business model in there, but you want it to be that the priority is, and what you get rewarded for is keeping people healthy. And because hospitalization is so expensive, that sort of becomes a reward anyway. You do get rewarded for keeping people healthy, because as soon as you have to put someone in the hospital, you're using a lot of your money.